This is Maura Enkelis at UCLA in the School of Public Health and the UCLA CTSI, and just wanted to thank everybody for joining the call. And as you just heard, Tom Valente from USC is here to share his thoughts and ideas about how we can all employ social network analysis in our research work. And I think, Tom, your reputation goes before you, and there's no need to say much else except that you're a great expert in this area, and we're really grateful that you could share your time with us. And this is in part follow-up to the CTSA Symposia on Dissemination, Implementation, and Improvement Science that was held in 2014 and 2015. And I think Tom's work was very popular among participants, and so we wanted to give an opportunity to share that and have some direct participation with folks in LA. So, Tom, if we'll just hand it off to you.
Oh, great. Thank you, Maura. Thank you so much for inviting me to give this presentation. And I admit to being a little bit confused in the sense that there are so many different organizations and institutions and agencies involved. I never know exactly at this point to whom I'm presenting and what people know and don't know. That is to say, we're USC, UCLA, RAND, VA, all kinds of stuff. And LA is a big and diverse town, so I guess it's understandable to have a bunch of big and diverse institutions participating in this. So all of that is by way of saying in advance, I apologize if some of the things I say are not new to you or some of the things are repetitive and you've heard them before, but I put together a rather general sort of introductory talk about social networks and health that, as is no surprise, will focus largely on the work I've done around understanding how social networks influence health behaviors and ways that we can use social networks to design behavioral interventions. So again, thank you all for signing up and participating on this webinar series, and feel free to interrupt me or participate in this conversation in any way you feel a desire to. Just know that we will allow time at the end for questions and answers to probe ideas that were not presented in the talk. So real briefly, my name is Tom Valente, as many of you probably know. I'm a professor at the Institute for Prevention Research, Keck School of Medicine at USC. And I've been at USC for about 15 years. Prior to that, I was at Johns Hopkins University for 9 years at the School of Public Health there. I need to figure out how to advance slides.
Yeah, just, Dr. Valente, you can let me know when you want to advance to the next slide.
Oh, okay, next slide. So just to acknowledge, I've been very fortunate to have funding from the National Institutes of Health, primarily NCI, although also other grants in the past with NIDA. These are the grant programs. Currently, the third one down there, the Global Diffusion of Tobacco Control Study, is still ongoing. I won't talk in any detail about that today, but for those of you that are interested in policy diffusion, we just had a paper accepted at Social Science and Medicine applying diffusion of innovations theory to the global diffusion of the Framework Convention for Tobacco Control. Okay, next slide. So I've organized the talk around three basic questions. What are networks and what do we know about them? And then a section on ways that we have used networks to study their influences on behaviors, and I'll present a whole bunch of different models for that. And then I've reserved the bulk of my time to discuss how we use networks and network science to accelerate diffusion and adoption, or to improve organizational performance, community-based programs, and so on. Next slide. So these are just some sample networks. You all know of networks. You've heard of networks your whole life. They're around all over the place. The one in the upper left is a graphical display of the Konigsberg Bridge problem, which was an early application and use of graph theory to turn that problem into one that could be solved readily once you conceived of it as a network problem. And then throughout the 1900s, we got increasingly sophisticated in our ability to graph networks, display them, being able to add colors and shapes to our graphical displays, and then recently being able to map very, very large networks, so much so that there are people today who routinely make network maps of the internet, the World Wide Web, buying behavior on Amazon, cell phone usage amongst individuals throughout a country, and so on. So the technology has evolved quite considerably in the past 10 years, and I think that has had a large effect on making the network approach more palatable, more accessible, and consequently able to be applied to lots of different arenas. Traditionally, network analysis in the 80s and early 1990s was confined mostly to small group type analysis, networks of 30, 50, maybe at most 100 people. But once the computing technology came online, we could start analyzing really, really large networks and estimate models about their structure. Next. And the next few slides are just examples of different kinds of networks. Networks are important because disease travels through networks. You can look historically back thousands of years and see the way communities, cities, countries, regions have come into contact with one another through network connectivity, and that has provided channels for the flow and spread of diseases, having what many would argue the most significant and profound effects on our history, on populations and communities throughout antiquity. Next. And then this next slide shows some work that Valdez Krebs did looking at the network of the 9/11 hijackers, how they were connected to one another, what that network looks like. And not surprisingly, our federal agencies today are spending money trying to use network analytic tools to understand terrorist networks and so-called dark networks or networks that don't want to be found. Next. And this is a really nice graphic by Rich Rothenberg about sexual contact networks. He did a lot of work in Colorado Springs with colleagues there to understand who was having sex with whom, the role of core transmission dynamics in the spread of HIV in Colorado Springs. And what they demonstrated, which is really significant, is that if you actually spend a lot of time and you gain the trust of the communities that you work with, it is possible to collect network data in a very sensitive situation. And so they did a really good job with that. Next slide. And here's a nice little network at courtesy of James Moody from the Ad Health data, looking at romantic relationships among high school students and demonstrating how they are structured. And, you know, in this particular example, seeing that actually there's one big sort of core group of of people that are all connected to one another via their romantic relationships. Next. And here's one of my favorites. This is a global map of science as of 2007. There are people who work in fields such as bibliometrics or the sociology of science, where you study how fields are related to one another, who cites whom, bibliometric work, who co-authors with whom. And through that, you can draw a map of how different disciplines are arranged in the academic or in the scientific world. I've always liked this one in particular because it has a nice pink box in the middle saying health and social issues are at the center of all of scientific inquiry. Of course, if you're a mathematician, you probably rotate this graph around a little bit and put math at the center, or one of whatever is your favorite discipline. But it is, I think, interesting to be able to look at science from this lens and see where things are related to one another, and the map makes a lot of sense in its arraying of the disciplines. Next. And then finally, a work that's very close to my heart is looking at collaboration among coalition participants or community-based organizations. This particular graph shows how a bunch of different organizations were connected to one another within this larger coalition. And the point of this particular study was to demonstrate that of the 130 people who were members of the coalition, we could use network data reduction techniques to collapse that network down to a core set of 16 organizations that were in this coalition. And these 16 organizations represented a variety of different agencies or perspectives. You had government, academic, school-based, community-based, and policy-based organizations. And one of our hypotheses in this study was that having this diversity of organizations and agencies in the core of the coalition enabled it to do its job well and for it to function well. Next. Okay, so those are just some pictures of networks, different kinds of applications that we have around networks. And the question always becomes, well, what do we know about networks? And it turns out there are some properties of networks that we've been able to elucidate, namely that networks tend to be homophilous, they are reciprocal, they are transitive, and they are scale-free. And in addition, they are clustered. And so I'll demonstrate what each one of these techniques looks like in these next slides. So by homophilous, we mean like sorts with like. And it turns out that people tend to be connected to others like themselves. When we look at networks, we're often looking in the mirror. And we know that homophily occurs for both sociodemographic characteristics, sex, religion, religious preferences, ethnicity, and so on, as well as behavioral characteristics, so smoking, alcohol use, and so on and so forth. Next. So here are some examples. I do a fair amount of work among adolescents in schools. These are data collected from sixth grade students who were 12 years old primarily at the time, and we asked them to name their 5 closest friends in their classroom. And sure enough, you see tremendous clustering on demographic characteristics. Here, all of the red nodes are girls, all of the blue nodes are boys, and you see overwhelmingly that boys are friends with boys and girls are friends with girls, with very few friendships connecting the different subgroups. Next. And then, of course, by 10th grade, this changes up quite a bit. Right now, we have boys and girls intermingled with one another quite considerably, and there are other characteristics that then start to take over as the sources of homophily. So, for example, kids with similar interests start to associate with one another, those that play on the same sports teams or belong to the same clubs or have the same cultural identities tend to be then affiliated with one another. And consequently, what you see, of course, is that these characteristics then have an influence on behavioral uptake that starts to occur as kids move through adolescence. Next. And then finally, and here's just a really nice graph by Jim Moody on homophily on ethnicity. These are from the Ad Health data, which some of you may be familiar with, and we have 3 different ethnicities in this particular school: white, African American, and mixed other, and you can see associations. People are more likely to be friends with others that are their same ethnicity. Next. Networks are reciprocal. So it turns out that if we look at friendship networks, there's a high probability that if Bob is a friend with Mark, then Mark is a friend with Bob, and so on. And so people tend to reciprocate relationships that they are in. Now, it's important to note that we measure lots of different kinds of networks, and some networks are inherently more symmetrical than others, whereas other networks are rather asymmetrical. So, for example, we expect advice seeking to be asymmetric, that people will report going to advice to others, but those others won't necessarily report coming to them for advice, which makes a lot of sense. And networks are transitive. It turns out that if a person has 2 people in common, if they know 2 people, then those 2 others are more likely to meet one another. So, for example, in this little illustration, we have Bob and John both connected to Mark, and so over time we would expect Bob to then become connected to John. And this kind of transitivity is something that we expect to evolve in networks over time, and we see it as a mark of cohesiveness. And of course, traditionally, this is sometimes the way a lot of people met their spouses. They would be common friends of somebody else, and they would be introduced to one another, and that triad gets closed. Next. More generally, in network analysis, we do something called a man census. Any network can be described in terms of the proportion of triadic structures represented in that network. So we look at different networks and compare them based on the frequency with which they have these 16 different canonical triadic structures. And some of these structures are more important than others. Some of them are ones that we expect to emerge in networks over time, and it's one way that we can test for the evolution of cohesivity in a network over time. Next. And this just points out that one particular triad, 030T, is the smallest transitive triplet. And And then the fourth property that we see a lot in networks is so-called scale freeness or centralization. So in many networks, there will be some or one person who's at the center of the network, whereas other people have more similar numbers of connections. So here in this graph, we can see that there's one node to which a disproportionate number of links are pointed to. Next. And we see this oftentimes in graphs of relationships. These are data from the classic Korean family planning diffusion study. And in the 24 villages that were interviewed, it was quite common to find a couple of people, in this case, number 13 and 20, who were at the center of the network and received a disproportionately large number of nominations. And of course, we see this in adolescent networks with people being popular. We see it in the World Wide Web with some websites getting a lot of traffic and others getting much less traffic, and so on and so forth. Next. And then finally, the last characteristic that we see in networks a lot is the fact that they are clustered. So here's a typical organizational network, and you can see down in the lower right-hand corner a group of 6 nodes that are all coded yellow, and they are all connected to one another. So there's a lot of clustering in this network. It would be very hard for new ideas to get into that group, but once it did get into that group, it would circulate rather rapidly, and behavior by some members of that group doing it would be reinforced by the others, and so on. So that's what we know what networks look like. Then the question becomes, well, how do they influence behavior? What are the models that we have to describe the way networks influence behavior? And the first one, the next slide, shows the very simple concept of network exposure. A person who has a lot of friends doing something is more likely to do it themselves. And so for many, many behaviors, we have measured the social networks and then calculated exposure among the population and shown a high correlation between being exposed to a behavior and the individual subsequently using it. Next slide. So you'll see here, of course, this person has much lower exposure and so would be less likely to engage in the behavior. Next. Now, of course, we have other models, the way social networks can influence behavior, and one of the more prominent ones was the notion of structural equivalence. In networks, we can describe whether or not people occupy the same position in the network, and we know from some empirical evidence that people who occupy similar positions in the network, that is, being connected to the same others, but not necessarily being connected to one another, are more likely to influence one another, right? So here, for example, D can influence ego even though they don't have a direct social relationship to one another. And we think this mechanism occurs more frequently for firms or for individuals or organizations that may be in competitive positions. And Ron Burt at University of Chicago is particularly good at documenting and articulating this process. Next. You have to hit the next slide a couple times because this is animated. So we have other models too. So for example, we think the strength of tie matters. If ego is more strongly connected to A is more likely to have a stronger influence on ego. We also have something that we call Semalian ties, that is being connected to the same third-party others. So for example, ego is connected to A and B, but A and B are connected to one another, so they're more likely to have influences on A. And we also see that ego is connected to E, and ego may make guesses about E's behavior, but that may be unknown. And we know from considerable research that what ego perceives E to do or support is more strongly with E's influence on ego than whether or not E does or does not engage in that behavior. And then, of course, the connections to C and G, the connection to C is through online media. We have some evidence that influence can be transmitted via online networks as well. And then one of the open questions is whether or not individuals can be influenced by those to whom they are indirectly connected to. So we don't know if ego can be influenced by G or G and H or not, and that remains to be seen. And then finally, the connection to F is there to illustrate that there may be characteristics associated with those alters that affect the influence equation on ego. Next. And then we also know that individuals that are connected to the same other events as ego may provide influences on him or her. So this sort of joint participation with other activities or identification with other norms can also create exposure opportunities that have been shown to influence ego's behavior. Next. And then finally, we have another mechanism that we call network selection, and that is that over time, individuals, instead of having alters influence them, people actually make network changes, and it's those network changes that become that create homophily in networks. So because A and B engage in the same behavior, they then become connected to one another over time and sever their links with ego, who then makes new links with other people who would have the same characteristic because it would be compatible with their behavior. So all of that is to say that we have a lot of different network mechanisms that we have articulated that show how social networks can influence behavior. And there's still a lot of basic network science to be conducted to understand the magnitude of those different processes and mechanisms and how they may or may not apply in different settings. So given that, though, if networks are important and if they do influence behavior, how can we use networks to make things better, to improve organizational performance or accelerate diffusion? And next, I've sort of developed this idea of network interventions. And network interventions are purposeful efforts to use social networks or social network data to generate social influence, accelerate behavior change, improve performance, or get any desirable outcomes among individuals, communities, organizations, and populations. And next slide. Before I launch into network interventions, next slide, sorry, that's just a reference to, and I think a bunch of these papers were sent out to you also. You have them, but if there's other things you want, please feel free to email me. Before I get into details around network interventions, there are three very important principles that derive from our work in health promotion and in public health in general, but I think that these principles matter even more when we consider network interventions than when we are doing regular health promotion types of interventions. Okay, and that first principle is that the program goals matter. Now, we know of the importance of setting goals and objectives before we start launching interventions, but in the network context, how we plan on achieving those goals and objectives is very important. And here I give the example of sexually transmitted infections, in which you can try to reduce them in two ways. You can try to accelerate the uptake of condom use, or you can try to fragment the sexual contact network. Both of those would get you the same end goal, but how you get there is very different, and they have implications for different kinds of network interventions. The next principle is theory. Now, I am a big fan of theory. I started my career as a mathematician and consider myself primarily a methodologist. But actually, theory is very, very important. And having a good theory, a good, well-articulated theory of what's driving behavior in any particular setting is very useful, again, for selecting the most appropriate network intervention. And I'll return to this point a little bit later on in the talk. And then finally, the third principle is that we, and this is a very strong public health guiding principle, in public health, we should always be prepared to try to learn from the community rather than just inducing change on it. I'm sorry, could you go to the next slide? So, and this point is very critical because we can't be seen as the ones that are just trying to push a lever to make communities do the things that we want them to do. We are actually in the position of providing the aids and facilitators to help communities achieve their goals. But a big part of the network approach is to use it to learn from the community as well as to try to create more effective interventions. Okay, next slide. So here's the big takeaway, the table that I put together in the network interventions paper. And this was the notion of developing different kinds of strategies that we use with network data. And then within each strategy, there are various tactics that we can employ. And within each tactic, there are various operationalizations that stem from the from the particulars of having network data. So the easiest way to think about this table is to consider the top row, where the strategy is identifying particular individuals. So in this case, we're thinking we're going to identify individuals to be change agents. Most of the time when we do that, and we've done this quite a bit, we identify leaders from the organization or the community. Now, those leaders can actually be identified through a variety of different network algorithms or operationalization techniques. So, for example, we can identify leaders as those who receive the most nominations, or leaders as those who have the highest closeness scores in the network between this and so on. Okay, so what this table does is articulate different kinds of strategies that we can follow, and within each strategy, the various tactics that are available to us, and within each tactic, the various kinds of network algorithms that may be available. Now, the point of this is that there are a lot of different network choices that you can make when it comes to designing interventions. There are a lot of different arrows in the quiver, if you will. Okay, so next slide. Now, in addition to identifying leaders, we have algorithms to identify key players. There may be situations where we want to identify people who bridge different groups. There may be situations where we want to identify people who are on the margins or on the periphery of a network. So, for example, we know that for some populations, people who are isolated from friendship networks are more at risk for mental health issues or less likely to receive healthcare services. So, in that case, we might want to use the network data to identify those people who are out on the margins or the periphery of the network rather than those who are at the center. And then there's a concept that I've developed called personal network threshold, which relates to the proportion of people you need to see in your network do something before you're willing to do it. Well, it turns out there are people that are low threshold adopters who are willing to adopt innovations early and change behavior early before their peers do. And in some cases, we may want to design interventions that identify those individuals first. Okay, next. So, as I mentioned, we've done opinion leader interventions. This is the most typical kind of network intervention. It's easy to measure who the opinion leaders are. It's intuitively appealing because we all think we have a good intuitive sense of what it means to be a leader and how important they are to organizational performance and community functioning. And this has actually been proven to be quite effective. We identified in our review in 2007 over 20 studies that have used network data to identify opinion leaders, and we identified hundreds of other studies that use different kinds of techniques to identify opinion leaders, and in these cases, they've been shown to be more effective than interventions not using opinion leaders. And I'll point you to a recent Cochrane review that came out in 2011 by Floodgren et al., doing a really good job of documenting a set of randomized controlled trials using network data to identify opinion leaders. Next. And then this is just an illustration to point out the different kinds of individuals we can find in networks, who the central members are, who the bridges are, group members, peripherals, isolates, and so on. Next. And then this slide just is here to point out that there are different kinds of opinion leaders at different levels of analysis. So early in the diffusion process, when you try to raise awareness and interest of a new idea or practice, we might rely on national opinion leaders. But as you move, as an individual moves through the different stages in the diffusion process, the role and importance of more local opinion leaders becomes more and more important. And the central principle here is that when people are making adoption decisions, when it's time for them to put rubber to the road and make decisions to do something, they need to have people in their personal networks who are experienced and trusted with the new idea practice in order for them to get over the hump and start to engage in the practice. So there are opinion leaders at all these levels, national, regional, and local. Next. Okay, revisiting this table quickly, because now for the next set of slides, what I'm going to do is take a network and show you, because we don't have time to go into details on all these tactics, just show you with that network what each one of these different tactics, and in some cases operationalizations, look like. So this next section will be pretty quick. So next. So here's the network. This is just a random network. We've got some behavior spread throughout the network, and we've got about 44 nodes in this network. It's got a little bit of clustering, a bit of reciprocity, and all of the characteristics that we talked about before, homophily on the behavior, and so on. Next. So if you want to identify individuals that are important, you might pick those that receive the most nominations. And that top graph shows you highlighting the 5 nodes that receive the most nominations in this network. And throughout this illustration, I will be using a rule of thumb of choosing leaders as 10 to 15% of the population here. So in this case, I chose 5, right? And then the next graph shows you who are the 5 nodes that have the highest closeness scores in the network. That is, on average, they are fewer steps away from everybody else than anybody else in the network. And then the lower left-hand side shows those 5 nodes that have the highest betweenness score in the network. In other words, they, on average, lie on the most shortest paths connecting other nodes in the network. And then finally, I think one of the best techniques for identifying opinion leaders is this key player algorithm developed by Steve Borgatti, in which he identifies individuals who span the network most effectively. In other words, these 4 individuals can reach everybody in fewer steps than any 4 individuals that we would have chosen from the network. Next. And then there are 2 versions of key player, one in which you identify the nodes that reach everybody the most quickly, and the other, the ones that, when removed, would fragment the network most effectively. And then we have measures for brokers, which is the upper right-hand measure. In the lower left-hand corner, we have measures for bridging, which are the individuals whose links, when removed, would fragment the network the most. And then finally, examples of low threshold individuals. Next. Okay, the next set of strategies are segmentation techniques. And in segmentation techniques, what we are basically doing is dividing up the network into groups because we think that the group level may have an influence on behavior. In other words, there are many behaviors and many instances which it only makes sense if everyone in the group engages in the behavior together and adopts it. Next. So here are illustrations. So for example, we can apply a grouping algorithm to the data, and we get these different groups indicated by the colors near the network. And so in this case, we might say, well, let's look at all the dark blue nodes and treat them as a group and try to get them to engage in the behavior at once all together. We can also divide a network up into positions. These are positions based on the similarity that the nodes have and their connectivity with other nodes. You get a very different kind of segmentation when you use position algorithms rather than grouping algorithms. And then finally, we can use hierarchical clustering. And in this case, what we do is we simply arrange the network based on the number of connections they have. And you can see that 8 and 28 sit at the top of the hierarchy, and then you move down. Next. So the third set of tactics fall under the strategy of induction. And induction, we are not trying to identify individuals or groups so much as we're trying to use the overall network structure to try to excite behavior change on it. And what induction does is it acknowledges that the dyadic structure, the specific links between people, is very important. So one way that we have operationalize this is to take a network like this. This again is boys and girls in 12th grade, and you can see who the central members are. Next. And one of the ideas here is if I want to change the behavior of node number 22, identifying a leader over on the left-hand side of the network, like person number 2 or number 3, they're not going to be effective at all at changing the behavior of 22. What I want to do is identify leaders that are proximate to 22 and use them as change agents. So next slide. We developed this. It's going to animate a little bit just to show this. So I think I have to space through this, forward through it. So we developed this optimal learner-leader matching model. So in this network, we can identify the nodes that are at the center of the network, and then for each one who's a leader, they are then responsible for the behavior, and they are specifically charged to influence the individuals that they are connected to, that have identified them as leaders. And in fact, we took this theory and tested it out in a randomized controlled trial and found it to be more effective than other methods for creating group-based interventions. Next. And then there are some other induction techniques, word of mouth. I won't go into detail on that. Snowball sampling, which has been used a lot in respondent-driven sampling type of interventions. Pairing individuals with others that are not engaged in the behavior, so you have that kind of network structure. And then the matching is the algorithm that I just showed you, identifying the most central nodes in the network and then assigning to them people who are closest to them based on the network data. Next. And then finally, the last strategy is alteration or manipulation, trying to make specific changes in the network. These, of course, would be very challenging. Networks are the way they are for a variety of different reasons, but we can reconfigure the links in the network structure based on trying to optimize different networks, making the network more centralized or more clustered or more transitive, or different kinds of networks. For example, we can try to make the network more scale-free. And in the next slide, again, you'll just see pictures of each one of these tactics. So in the upper left-hand corner, we've identified the nodes that, when removed, would fragment the network the most. If we added nodes to a network, where would we put them in order for them to be most effective? Which links would be most critical to delete in the network, or which links would be most important to add to the network in order to make it the most cohesive? Okay, next slide. And then finally, we can rewire the networks based on making it a small world network. You can see the structure of this network on the left. Now that it's a small world network, it's very different from the structure that existed in the original network. And then finally, rewiring the network on behavior, where we're linking non-users up with groups of users so that they have somebody to go to for advice and influence. Next. Okay, and then this last slide's just a picture to put all these different choices together and then to illustrate that obviously this is not exhaustive. There are other kinds of network interventions that are being developed and implemented in a variety of different settings. And so the full story, of course, on the role of network interventions is yet to be told. Next. So I have all of this that you have seen. All of these network intervention choices have been written in an R script that is publicly available. I use R for a lot of my network analysis now, and if you are seriously contemplating becoming a network analyst, then learning R is a good thing to contemplate and to consider. And if you want this R script, please feel free to email me, and I will email it to you. Next. So the question becomes, of course, with all of these network intervention choices, how do I select a network intervention? Well, it depends in part on the type of data that you have. So, for example, in some cases, there may be no existing network and you have to create a network. Or your existing network may be very, very centralized, in which case, if it's very centralized, you're probably going to have to work with the opinion leaders within that network to make any progress. The other issue, of course, is the behavioral characteristics. If you're working in a community where there's absolutely no behavior being done that you want, then that has implications for the kind of network intervention rather than if it's already a behavior that's rather widespread. And of course, the perceived characteristics of the behavior, its cultural compatibility, cost, trialability, and so on and so forth. Next. But what's actually a little bit more interesting to me is to think about linking our theory to the kinds of intervention strategy we would choose. So, for example, if we know what kind of mechanisms are driving the behavior in the setting that we're working in, that may have implications for the kind of network intervention we want to choose. So, for example, next slide, I've put together a list of linking all the different theoretical mechanisms that may be driving behavior to the different kinds of tactics that you want to use. So, for example, if you think that power is very important in this network, then identifying leaders would be important. But if there's a lot of conflict in the community, well, finding bridging individuals that span those different subgroups could be really important. If there's a lot of cohesiveness and that can drive the behavior, key players could be identified, and so on and so forth. I won't go through all the list, but this is an attempt, and again, this isn't really backed by any empirical data, but really thinking about what kinds of mechanisms are driving the behavior under study and what kind of intervention that's yes, from a network perspective. Next. And then finally, just this past summer, we published this paper on using social network analysis for program implementation. And what this does is broaden the lens on how we conceive of network analysis for use in understanding how to implement programs. And we took the EPSIS framework that Greg Ahrens had developed, where we divide our program development process up into different stages: our exploration stage or needs assessment, the program design stage, or when you adopt a particular intervention strategy or tactic, once you implement that program, and then tracking its sustainment and monitoring. And these, from a network perspective, would fall under the different approaches of network ethnography, network interventions, network diagnostics, and network surveillance. And this paper explores the kinds of network measures and metrics you would use at each one of these stages and the kinds of goals you would have for using networks to help improve the program implementation process. Next. So, in sum, there are network theories and methods that can be used to develop behavior change interventions and really help us at every stage in the program implementation process. Our network analysis tools have improved substantially so that they work really, really well and for very large data and in a variety of different settings. And of course, the emergence of massive passive data, of large data sets, so-called data mining, make it possible to apply network ideas and concepts to ever more broader and larger settings and applications. Next. And I think that social network analysis is something that really is providing the opportunity to be applied in a lot of different organizations, communities, and other settings. There's been some interest finally from NIH and other sources to fund network analysis projects. And I personally believe that doing network interventions and doing experiments to find out how networks work in different settings really provides a good opportunity to advance human behavioral science as we understand how networks work. And so far, to me, what evidence we do have does seem to indicate that networks can be very helpful for improving our interventions. Next. This field of network analysis is there is now a new about 3 years old now, a network science journal, other specialty journals emerging, network biology, for example, where this whole idea of things being connected to one another has important and profound implications for how we understand the way systems work, the way individuals work within those systems, and the way this connectivity can affect all kinds of different behavioral aspects. And then finally, I'll just point out that some of you may be familiar. I have this book, Social Networks in Health, which provides a fairly decent introduction, next slide, to the field of network analysis as applied to health behavior. And then the old Network Models of Diffusion of Innovations book I did some years ago, articulating how networks channel the spread of ideas and practices. So I know I've rushed, but I find, with this kind of impersonal webinar environment, it is more of a blast out rather than a dialogue, but I've attempted to leave time for questions and answers, and hopefully we can have some discussion about what's missed and what this talk did hit on and where it was left missing and what other kinds of information needs may be out there. So thank you all for your attention, and I appreciate this opportunity.
Thank you so much, Tom. That was really fantastic. It had so much information for us, and it was so helpful. I think we're now going to unmute everybody who's on the call, which is a good number of people. So as that happens, just a reminder that if you leave, if you could not put us on hold so we hear music, and just try to mute yourself if there's some ambient noise or you're using your keyboard, just so that we can hear everyone who is. Somebody did it. Yeah, exactly. So the example that we just heard, that's a great example of what not to do. So thanks for whoever did that for us, so we knew the impact of that behavior. So just keep yourself muted if you can on your end, just so that everyone can ask questions who would like to, but we're not disturbed by ambient noise. So we just wanted to open it up to
Maura,
anyone.
I'm glad to hear you say there were a few people on the call, because throughout the talk I kept hearing people click off, so I wasn't sure how many made it to the end.
Don't worry, Tom, those were not all people leaving. Although I honestly wasn't tallying, but I can tell you that it was both joining and leaving. So
questions?
Hi, Dr. Valente. This is Bethlehem Mengeshe here. I actually took your social networks and health class back when I was in grad school at USC with you. Not a question, but just wanted to thank you so much for giving the presentation. Very interesting stuff, especially in the age of technology. So thank you so much for giving the talk.
Oh, you're most welcome, and thank you for keeping in touch with me. And I, you mentioned social media, and one of the key scientific questions going forward is, yes, social media or social networks, but social networks and social networking are not the same thing. And so the extent that some of these social network interventions can be translated into social media questions, I think is an open question, and it's one I think that we definitely need to and want to wrestle with, because in a way the social media avenue provides the opportunity for scale up that the social network avenue does not.
Right, right. Well, thank you so much.
Oh, you're welcome.
Does anyone else on the line either have a comment or a question about how to use social network analysis or a clarifying question based on what we just heard?
Hi, Dr. Valente. This is Marcia with Speedlink Consulting, and I wondered if you could go back to the slide on exploration, the stages of program implementation.
Yes, the EPSIS framework and the paper on social network approaches for program implementation.
Yeah, we are doing an evaluation of a countywide implementation, and I hadn't thought of social networks before, but in interviewing the stakeholders and the providers, they talk about learning networks is very helpful. And I just wondered sorry, I hear a lot of music. I just wondered if you could say a little more about that slide.
Well, so let me say a couple of things about that. Hopefully you all can hear me over the din. For one, what was interesting to me about conceiving of this paper and writing it is it continued to sort of pull the lens out more broadly about the ways we can use networks for everything that we do when we think about bringing about change. And it turns out that when you're implementing something countywide, people are implementing it in organizations, and they're learning from one another, and they are only going to go so far as the people they're connected to are going to go, because nobody's going to want to be way out in the front of this, right? Because they're going to be the ones that have to sort of do all the learning, the pioneers. Being a pioneer is not a good thing, because it costs a lot, you end up with a lot of mistakes, and it's a lot of hard work. So people generally want to sort of do things with other people and go through the learning together. And when they are implementing new ideas, they're learning about how it works, but they're going to talk to other people and say, hey, this situation X happened in our organization. Are you seeing the same thing over there? And that's the way learning takes place. We learn from other people. People are social animals. So, but understanding how the network is structured and the way people can learn from one another is very important. And I'm glad to hear you say the word evaluation. That's another hat I've been wearing for a long time. And in part, this comes out of thinking about, when you evaluate your programs, it turns out that the individual networks that people have, or the organizational ones, tend to mediate and moderate the effectiveness of our interventions to bring about change. And I know I'm working a little bit with one of my colleagues, Luann Rohrbeck, where they are implementing substance abuse treatment counseling programs countywide, and we are looking at the networks of the implementing agencies all across the county. And it's been pretty fascinating.
Thank you very much.
You're welcome. And I believe you all have that paper, if I'm not mistaken.
Yeah, it was circulated to everyone, yeah.
Are there other questions about what we just heard, or questions about how you might apply this in your own work? Just to follow up on the last question.
Let me just add, and people are probably thinking about getting off, but one thing I might add is, there is a perception out there that network data are very hard to collect and hard to analyze. And I always like to say that I don't think that's true. Networks are one of the most intuitive things people know about. Now, there are a variety of different ways of collecting network data, and that can cause confusion. But usually I find that the actual collection of the data is pretty easy.
Great. Just wanted to add in before we ask for any other questions, Ibrahima is going to be putting up a very short evaluation, just like you were saying, Tom. Data is collected in very small increments, so we just have a few short questions for you. So if you could, before you leave the call, please fill that out. That would be very helpful just for our future planning. I wonder if, Tom, would it be, while other people are thinking about questions they may have, I wonder if it would be helpful if you could give an example of a few, and I think there are some examples in the materials that you sent out and some of your materials on the web, but perhaps a few examples of the kinds of simple questions that you ask on surveys, and perhaps maybe an example of sharing the data back where you were trying to facilitate people having a conversation about, for example, kids maybe not in a network in a school who you might want to pull into a network. Just some maybe guiding questions, examples of guiding questions you use to help people look at the data and make sense of it, which I know there are many, many possible applications.
Right, and my recommendation is usually the questions to ask on a survey are, who do you go to for advice about a particular practice, and who do you discuss that practice with? And these tend to tap in two different dimensions of opinion leadership and interpersonal influence, advice being credibility or expertise, and discussion being trustworthiness. And you get differentiation in the networks when you ask those questions. And the easiest way to do that, of course, is if you're in an organization and you can preload the roster into an electronic survey collection system with Qualtrics, and you can assign a number to each person, or they just select a name, and then there's a number automatically attributed with that name, and then the data are there ready for you to analyze. And when you ask questions like that, they tend to go pretty quickly. In other words, you can ask for people to name up to 7 or 10 others they go to for advice or discuss issues with, or think are experts or leaders in the field, and the data are quite readily collected. There is a tricky part, which you mentioned in your question more around feeding the data back. My experience has been, now typically we keep the data anonymous, right? It's not, or we keep it confidential. It's not anonymous because we know which individual named which other individual. So we lose anonymity in our research, and that is something that we have to contend with. When we go to the step of feeding it back to the organization, we only use those numbers so people don't know who the names are. And generally people want to see the names. They want to know the structure. Now, depending on the setting that you're working in, that may or may not go smoothly as a process. And one of the things I've been recommending lately is, letting people know this is not anonymous data, your name's going to be identified, and would you ask for permission to be able to display names in the chart? And I haven't had much experience with this yet, so I don't know how well that's going to go over. And I suspect that it would vary quite a bit based on the culture of the organizations. In other words, if the process of change is controversial, if what you're trying to do is controversial, if mistrust is high, then people are going to be very reticent to share their names. On the other hand, if you have a lot of cohesiveness and everybody's quote-unquote on the same page, that process may go more smoothly. I think we need to do more work in this area to understand how best to figure it out. And, of course, for many network interventions, we don't need to go to that step of feeding the data back, but in some settings that may be a desired outcome, and so those conversations need to occur.
Great, thanks so much. Are there any other questions that anyone has? I wonder, Tom, if I could just follow up with that with one other question, although I think you gave examples in your talk. I was wondering if you might be able to share an example where, whether you shared the actual names or not, where you, examples of, assuming that you think this is an underutilized way of using network analysis, kind of shared the network results back to a group to have them think about what do we want the network to look like and or what should we do, like maybe just a concrete example of doing that.
Right. So I did a little bit of work with the Children's Health Insurance Coalition here in Los Angeles, and one of the things that we asked the question, who would you like to work with in the future? And overwhelmingly, everyone pointed to the healthcare services organizations, those that actually provided services to children, and so that became an issue of emphasis going forward for the coalition. Definitely, the perception that the health service organizations, although they were somewhat center, there was a desire by everyone to have them more active in coalition activities.
And I wonder if you, again, I think you might have hit on this, but I'm wondering if there are any examples you can think of areas where you think are especially promising where network analysis might be used much more routinely than it is for interventions that we don't think about, like showing what a network looks like to kids and having them think about how to use the information, or if you can think of some examples where you think it's just really ripe.
Yeah, I mean, there's a lot of places where I feel it's appropriate and ripe. I think for adolescents, it's very important. And something that I think schools should sort of regularly be monitoring to find kids that are at risk, and to find kids that could be influential in turning groups away from engaging in risk activity. The kids cluster on these risk behaviors, and teachers know it from a distance, but I don't think they know it in a deep and profound way, in ways they could act on it better. I think organizations should routinely be collecting network data so that they can distribute the workload among different individuals. In other words, in my world of worlds, every organization identifies everybody as a leader, but for different domains, and that the leadership gets distributed across different domains, and people know who they should be, informing about developments in different areas. And I do feel rather strongly that when it comes to implementing new ideas or policies and practices in different settings, that understanding how the behavior is being adopted from a network perspective is critically important, because if the first users of a new practice are on the periphery of a network, it's going to take a long time for that behavior to percolate to the center of the network and to develop a more widespread uptake. So understanding the position of those early adopters is very important, because early adopters are not necessarily leaders, and leaders are not necessarily early adopters. And we know that there are different characteristics of behaviors and interventions that will be differentially associated with the position of those early users.
Great. So could an example of using, as you're saying, using social network analysis almost as a routine surveillance mechanism perhaps for schools to just understand how kids are linked up, what that means for what they're trying to accomplish, or their kids that they might want to worry about where right now they might use other instruments, but if you actually could see the network and visualize it. And then do you think whether or not the way that the network looks visually is actually the way also kids report, like their perception of being isolated versus where they look on a map, do those things correlate or not? I mean, that would be a relatively potentially easy thing for schools to do, again, just as an example.
Yes, absolutely. And as a bullying intervention, boy.
I think there might have been a question come into the chat, so I'm just trying to look to see. I don't know if, Tom, are you able to see the chat? No. Okay, sorry.
I clicked on it, but I don't see anything.
Yeah, it came in privately. So I'll just read part of a question, which is, if you could speak a bit to how data are collected when social media is influencing behavior, but not necessarily through individuals that a research subject would identify as in their social network. Like when there are comments from Facebook pages, et cetera, that are collectively influencing behavior.
So Facebook's an interesting case. You know, it used to have an open API, and you can see everything. Now, there are different ways that you create connections with Facebook users and then can look at their data. And once, you know, unfortunately or unfortunately, I'm not sure what it is, but if, you know, researchers can set up a system by which they connect with people over Facebook and then can look at all of their data. And some people may be aware, or some people may not be entirely aware of what's going on there. But having said that, that's done, then you can look at, yes, comments that people are posting on Facebook. Is it ethical then to look at the comments that somebody who's not necessarily a research subject has posted to a website? That is an open ethical question, I guess, in some ways. But I think most people should realize by now that stuff that they do on social media is public. And is going to be public. So I think it's probably okay for researchers to look at that. I'm sure some IRBs have wrestled with this issue and probably come down on, well, if people make their Facebook data public, then it is public, and fair game to be analyzed, I suppose. Does that answer the question?
I'm looking at chat to see if we get a yes.
Oh, yes.
A yes, thank you, exclamation point. Thank you so much. It was great. All right, a little slow in the uptake here using the technology. All right. Any other comments or questions from the group? This is really great, Tom. Really, we just want to thank you so very much, and also for all the resources that you shared, which enable us to now delve in now that we, for those of us who needed a bit more of an introduction. And I don't know if you want to, is there any few parting comments that you want to make before we wrap it up for today?
No, I'll just encourage people to contact me if you would like. There are other papers and writings on this topic. I think I shared the relevant ones, and you know, I love doing this work and happy to help people push it forward if it's something that they think is appropriate for their setting. So, and I appreciate the time people put into listening in and paying attention. So I thank you all very much. Thanks for the opportunity, and hope everybody has a good afternoon.
Thank you so much. Just really appreciate your being gracious to share all your time with us and all the resources and thinking. And just one last plug for anyone who can help us with the evaluation, please do that before you leave the call, and we'll be in touch soon about the next scheduled DII call for our local community. So thank you all so much for joining, and talk to you soon.